Trauma Therapist Podcast Plus listeners can listen to episodes early and ad-free right now. Become a Plus listener by going to Apple Podcasts, searching for the Trauma Therapist Podcast, and signing up today. Welcome to the Trauma Therapist Podcast, a show about the incredible people dedicated to helping those who've experienced trauma. My name is Guy McPherson, and my mission is to raise the awareness of trauma and to inspire each of us to help those around us. You ready?
Yeah.
All right, here we go. So 5, 4, 3, 2, 1. All right, folks, welcome back to the podcast. Very excited to have two guests on today, Kristin Arden and Shari Botwin. Welcome, both of you.
Hi there.
Hey, Kristin,
Hi,
welcome. I'll read your bios and then we'll jump in here. So Kristin is a lead clinician at Mindbloom and is a board certified psychiatric nurse practitioner with over 15 years experience working in mental health. Her work has been instrumental in the development of Mindbloom's treatment methodologies. In addition to work at Mindbloom, she was a guest lecturer at NYU on topics such as psychedelic therapy and substance use disorders, and practices addiction medicine from a harm reduction mindset with individuals in the justice system. Shari, of course, a repeat guest here on the podcast, has been counseling survivors in recovery from all types of trauma in her Cherry Hill, New Jersey private practice for over 28 years. Her most recent book is titled Stolen Childhoods, released worldwide in May 2020. In hardcover and ebook. She's been chosen by Tantra Media to narrate the audiobook, which comes out. Did that come out already?
It came out. Yep. Last month.
Is out. Awesome. We'll have that linked up here at the show notes page. So welcome both of you. Before we get going here, I want to ask both of you where you're from originally. Kristin, why don't you start where you're originally from and where you are currently?
Yes, I'm originally from Los Angeles, and that's where I started my mental health career in the state hospital system here in California. And that's actually where Circle of Life took me back to Los Angeles. So that's where I'm at currently.
All right, awesome. How about you, Shari?
I am in the very hot and muggy and disgusting outside of Philadelphia. So I'm on the opposite side of the country as Kristin.
All right, awesome. So really fascinating here. We've got Mindbloom, we've got both of you and how you come together. Let's start with Mindbloom, what it is. Kristin, I'll ask you to talk a little bit about that. And then we're going to talk about why you and how both of you are together here today.
Sure. So Mindbloom is a mental health company that is on a mission to transform lives and transform the world by implementing different alternative therapies into the treatment of mental health. And specifically, what we've been utilizing is treatment with ketamine, and it's at-home ketamine therapy. So we've been in practice treating individuals for about 5 years now and have facilitated about 450,000 at-home ketamine treatment sessions in 36
I thought you were going to say 450.
That's what I thought.
But you kept going. 450,000.
Yeah.
Wow.
And across 36 states. So we have like about 80 clinicians, that psychiatric clinicians, either psych NPs or psych PAs, and about 80 psychedelic integration guides or coaches that work for us.
And it's at home.
It's at home. Yes.
Wow. Okay. So many questions. But before we do, give us the thumbnail, Kristin, of your background. How did all this come about for you?
Yeah. So all of this came about for me from, like I already mentioned, I started my career in the government sector. So in California, and the inpatient state hospital system. And then I transitioned to outpatient behavioral health at the VA in New York. And my whole goal when I started my career was I thought like go to where people have, I thought like the most serious needs, because that's where you're going to be able to impact the largest change on the mental health care system, both in trying to improve outcomes and access to care. And after 13 years, I didn't really see things change too much. So I kind of stood back and was like, I need to reevaluate my strategy for my career. And that's where I found that healthcare technology companies existed. And I've always associated startups and technology with innovation. And so I know that with innovation, if I'm working for a company that's innovative, maybe I can be more involved with actually seeing things change in my lifetime of my career. And so that's how I ended up at Mindbloom, which is actually my third healthcare technology company or startup. So like a big passion of mine and what my doctorate was focused around was how do we cut down the timeline from evidence being published and available on paper to actually applied in practice and having a benefit on people who need those outcomes in a practical or a practice setting. So that's what we're really focused at. I think of our focus at Mindbloom is like we have a lot of great evidence out there for ketamine therapy was sitting on paper, and there's a lot of opportunities to further innovate how we provide ketamine therapy to make it more affordable and accessible to people.
Okay. And before we get to you, Shari, for our listeners, what is ketamine? What is ketamine therapy? Kristin, I'll ask you that.
Oh, sure. Yeah. So ketamine therapy is treatment, the medication called ketamine. And ketamine is a medication that was improved in the 70s by the FDA as an anesthetic. So it's used outside of a mental health treatment in an on-label setting for surgeries, for anesthesia, and for pain. So in pain management. Over the course of time, people started realizing, or clinicians, researchers started realizing that people, when they received ketamine for anesthesia or for pain, that they also noticed improvement in their mood. So clinicians, since the first papers were published in the early 2000s, have been growingly prescribing ketamine off-label for mental health indications such as depression and anxiety.
Okay. Now, ketamine is often, and correct me if I'm wrong here, but it's often talked about when people are talking about psychedelics. Is ketamine considered a psychedelic?
I think there's a debate around that. I consider ketamine a psychedelic because it produces psychedelic properties that people experience like a mystical state of consciousness, visuals, will hear things different. I always describe it as like your five senses are affected by the ketamine. So it's just like however you interpret things through your five senses will be altered or can be altered. But some people would classify ketamine as a dissociative substance and not a psychedelic.
Okay. Shari, now, where do you fit in here?
So I'm brand new to Mindbloom. I jumped on board a few months ago. One of the people that works at Mindbloom saw and read some of my other book, Thriving After Trauma, and saw that I did a lot of work and have been doing a lot of work with people who are in recovery from all types of traumas and been diagnosed with PTSD. So I was brought on board to offer content, to offer videos and recordings that address different aspects, things that you and I have talked about on your show, whether it's overcoming shame, battling and learning how to deal with guilt, figuring out how to move into a place of grieving and self-compassion and self-care. So what I did was I developed this part of the program with some of the Mindbloom employees, professionals, people who run the company. And then I had a chance to talk, which clients will be able to listen to me talk about, here's what you need to do now that you're in a different state of mind, now that your mind is opening up and you may be seeing the world a little bit differently. Now's an opportunity to really look at the parts of your recovery where you feel the most stuck and implement some of the strategies that I talk about while undergoing the ketamine treatment.
Oh, wow. Interesting. So Kristin, when you're talking about or introducing the topic of ketamine treatment for people, where do you start? Let's say, who is this for?
Yeah. So I think how we start at Mindbloom is through an evaluation with our clinicians. So that's like people go through a screening process, like a candidate survey, kind of like an initial screen out process first. And then they schedule a full psychiatric evaluation with the clinician that's anywhere from 45 minutes to an hour long. That's typically where our clients start in this process, but kind of understanding, like, even before we get there, like what kind of person, or if I'm a person considering this, like, when would I even consider filling out this survey to see if I might be a good candidate. And I think that works a little bit differently for depending on the individual. So I would say that this, if you're like, first off, if you're experiencing symptoms of depression, anxiety, PTSD, it would be maybe, I think that's the first step worth considering. Like,
so basically everybody.
What are the treatment options that are out there for you? Right. Exactly. And then I think individual needs. There's definitely like some people who see this, like, are not into traditional treatments, medications like SSRIs for whatever reason. Ketamine might be a good option for them because it's a whole different approach to treatment. It's not something you have to take every day. There's definitely a psychotherapeutic process that goes along with this too. So it's not just relying, kind of giving our power to the medicine to fix us. Like, we're an active participant in our healing process, which some people are drawn to. But it also is a good option for some people to consider that are on SSRIs or other traditional medicines and maybe not receiving the full benefit. Maybe you've had like a 50% reduction in your symptoms, but like not really living your life still to its potential fullest, and you're looking for something to augment that. I think ketamine's a great option in the fact that it doesn't work primarily through the serotonin receptor system, which means that it can be taken in congruence with a lot of the medications that we use for mental health that are serotonergic without the risk of drug-to-drug interactions.
Okay. So you mentioned depression, you mentioned anxiety. Obviously, those are often can be symptoms of trauma too. Mm-hmm. So is this appropriate for people who've experienced trauma, whether that, obviously there's a whole continuum of what trauma is?
Mm-hmm. Yeah, it really, that's something that's determined on the evaluation with the clinician. So what our clinicians are doing in the evaluation is, one, identifying, like, is ketamine a potential treatment option for someone? Like, do they have an indication that the evidence tells us that ketamine could possibly be beneficial for? And then two, is ketamine at home following Mindbloom's protocol safe and appropriate? And I bring that up, and specifically, I think most important context when we're thinking about individuals with past trauma or with PTSD, because we understanding how ketamine works. And something I always share with individuals is that a part of the process that leads to healing could mean that things get worse before they get better. So if you're doing this treatment at home and meeting with your therapist, 5 days later, or maybe you don't have a therapist, maybe your therapist isn't aware of how to support you or help you process this, like, it might then not be a good idea for that individual to go through ketamine treatment at that time, because we would want to make sure that they have all the supports in place. But if they feel like they do have like a therapist that can support them with processing and working through whatever came up for them with the treatment, then ketamine therapy might be an option for that person. So it's really a matter of going to, like, what is their current level of resilience and ability to, like, process or come work through some challenging content if it did come up, and then what other support do they have around them to help keep them safe and feeling supported.
Shari, what would you add to that in terms of the trauma piece and questions people might have to see if this is appropriate for them and so forth, or even if they're going through it, what they might want to keep in mind?
I think one of the most important things when you're going to add different parts to your recovery is really making sure that you have a team of supporters. And like Kristin is saying, to be able to talk with a therapist who understands the use of psychedelics, or if you're a therapist that doesn't really have that type of training or background, to consult with somebody, whether it's at Mindbloom or in their own therapy network, to understand more about what would the role of psychedelics be and how would you implement that, especially if when you start using the ketamine, you do notice that things are starting to feel even more raw and vulnerable. One of the things that I think is very important and that I value about Mindbloom is that there is attention and focus on one's safety. And as we all know, people who are battling with PTSD often struggle with different types of self-harm or eating disorders or substance misuse disorders. So to really be clear that when someone is considering using this type of treatment, that it does happen when that person has a lot of support and also is in a place in one's life where if things do start to feel like they're unraveling, to know that they will not be by themselves in that process.
All right. So let's, if we can, Kristin, here, get specific. Obviously, everyone's different. Every case is different. But walk us through a scenario of what this would look like. Say someone's listening to this. They have some anxiety. Maybe they've experienced some trauma. They want to go through with this. They're on board. What do? Walk us through what happens.
Yeah. So step by step. So first thing you do is go to the Mindbloom website and you fill out the initial candidate survey. If you get past those initial screenings, that initial screening criteria, then you're going to fill out a health history, like you're kind of like a history or intake form. Then you're going to book an initial consultation with a psychiatric clinician where they're going to do review how you're feeling today, your psychiatric history, your medical history, your family history, and they're going to make a determination with you based on that information on is Mindbloom a good fit or not. If so, they're going to provide you with a lot of education about the program so that you can be informed of what to expect next and all the safety information. And then they will order your medication. So you yourself would then book your first treatment. So you're doing your first treatment on Zoom with a guide. So the first appointment is 2.5 hours where you're on Zoom for the first 30 minutes and on Zoom for the last 30 minutes with the guide, doing a preparation session where you're talking about your intentions. You're going through all the steps on how to take the medication. The guide's helping you take your blood pressure and your heart rate, and we're making sure nothing's changed physically. So it's a safety check and like making sure, helping you get in the right mindset to do the session. You're signing off, you take the medicine. The medicine is a tablet form and it's sublingual. So you hold it like under your tongue or kind of in the space between your cheek, your gum and your cheek. You hold it for 7 minutes, you spit it out, and then you lay down, you have headphones on, an eye mask on, and you're generally listening to like the first 7 minutes is like a spoken word or like content to help you kind of ease into the experience and prepare your mindset. And then it goes into a music soundtrack. You lay down in kind of this, like the best way I can describe how it feels is like a deep meditation. You still know who you are, where you are, what you're doing, but you're slightly removed from yourself and genuinely like feeling like you're connected with yourself at a deeper level than maybe you would be on a typical day.
All right, let me pause if I may here. So this is something that you set aside, ideally set aside a big chunk of the day to do, if not the entire day?
About 2 hours or so. Mm-hmm.
Okay. Now, does someone want, if I was going to do this, would I want my partner there? Would I want someone else there?
Yeah, great question. That was something I was gonna highlight, and it's really key for safety and a criteria for treatment for Mindbloom is you have to have somebody there with you. So you can't do the treatments home alone, and you need to have like an environment that you feel safe in and someone that you feel safe and supported by. So that's the other component too. Like if you're in a tumultuous relationship with someone and like that home environment doesn't feel safe, then like doing this treatment might not be a good option for you because like we pay a lot of attention to your mindset, set and setting. So your mindset going in, making sure that that's healthy, and then also the setting, your environment that makes sure that's healthy and conducive to a therapeutic treatment.
Okay. So 2 hours, alarm goes off.
Mm-hmm. There's some music plays a chime, then you get up. You have the person that's there with you next to you to make sure we call them your peer treatment monitor. They're there to make sure that you're safe and help you get to the bathroom if needed. And then you're journaling for 30 minutes. So we encourage we send all of our clients a journal. It's either like you're collecting a chain of events of thoughts that came up for you in the session, or using that time as like a stream of consciousness to just get out whatever you can on paper. And then for the first session, you meet with the guide after you've done the treatment and journal for 30 minutes to talk about the experience, and they help you kind of frame what came up for you around your intentions, and they give you some pointers on what you can do in the next following days for a process that we call integration, which in summarize what integration means high level. It's like, how do we take an experience like the one we have on ketamine and integrate it into our daily life in some ways so that we can do our best to affect lasting change versus this being just an experience that we have, ends up in our journal, in a drawer some way, and we never think about somewhere and we never think about it again. So the treatments are 6 treatments once a week, like spaced out generally about once a week.
Okay.
There are a couple more check-ins that you would do with your clinician as well to adjust dosing. Last couple of things I'll share is that the program does come with the one other one-to-one integration session with your guide that people usually do around the 3rd or 4th treatment. And then you have unlimited text support, the guide, direct access to your clinician whenever you need them you can check in with them, schedule those check-ins throughout the program. Digital content like what Shari put together, that you can pick a pathway that you go through if you want to go through a pathway that's focused on trauma or focused on burnout. Like we have a digital content or learning content that is guides people through the experience as well. And lastly, integration circles, which are moderated by our guides and you have unlimited access to. And it's like a peer support group with a guide that's moderating it.
One thing, kind of going back a little bit, you mentioned intention. So if this hypothetical person we're talking about here who maybe has anxiety, they're interested in doing this, talk about the importance of intentions and what role does that play in this here?
Yeah. So setting the intention really helps you align on what your purpose is for doing the treatment. And typically what I'll have people do before a session is one, like the best advice I give about like intentions is keep it simple, keep it more broad. Because really, it's something I say, if we knew what we needed going into these treatments, we would probably have it already figured out. So our idea is set this intention and let it go.
So what might an intention be?
Like an example, one, like a very simple one that it works for some people is like, my intention is to let go. My intention is to trust this process. My intention is to quiet my mind, reconnect with love for myself. So those are all really common intentions for people.
Okay. And the clinician, the guide, to what degree are they providing therapy? What are they doing? What's their role more specifically here?
Yeah, so the clinician, they're psychiatric clinicians, and a good portion of them have training to do therapy and maybe do therapy in their private practice setting or something outside of Mindbloom. But at Mindbloom, they're not taking on the role of a therapist. So the psychiatric clinician is primarily prescribing their medication, monitoring progress to make sure that this is something that's working for someone and they're able to do so safely. They usually do provide some brief interventional type of support for someone. It's not like, here's your ketamine and we're out the door. It's a lot of like,
Right.
how are things going for you? Like, tell me a little bit about your session or your experiences. And they'll try to help clients kind of understand their experiences. But the guide that I mentioned too is like the kind of like we think of their treatment team at Mindbloom as the psychiatric clinician and then the integration coach or guide. And that person's really there to support them around their experiences, help them understand, like if this was my intention and this is what came up for me, how might I make sense of that? And then what are some things that I can do to like help those insights stay with me? They're not a therapist and they're not filling that role of a therapist. Another way I sum it up, because it can seem a little bit murky in a way, without specifics, is I think about like the guides are very pragmatic. Like, this was your experience. Here's some steps you can do to get the most out of this. And they're not going to the history. They're not going to digging into the deeper parts of it and trying to understand the why and the context and framing, the bigger picture kind of root of what someone's experiencing, but more so like pragmatic. This was your experience. Here's some things that you can do to integrate and create lasting change based on that.
Shari, in terms of the trauma piece and the trauma pathway, as I think it was called, fill in some gaps here for us. If someone was kind of wanted to pursue an intention around healing, quote unquote, healing from trauma, what would you add here?
What I would say to people is, as you're undergoing the ketamine and you're journaling and you're really processing, this is the opportunity when you want to go to your therapist, the person that you're doing the work with, the person that you're telling your story to, that knows your history, and take that ability to process maybe more openly or with a little bit less emotional pain, to be able to then go into your therapist's office. And again, not just one time, but each time, and begin to explore the parts of your trauma that you've been stuck in, or that you feel like you suffer the most from. Like, for example, when we did the content, we focused a lot on shame, feeling worthless, feeling inadequate, feeling like this world would be better off without me. So what I would say to somebody undergoing the ketamine is, if you want your intention to focus on letting go of shame, what you would want to do is utilize the ketamine and then come and journal about what are you wanting to let go of, and what do you imagine would be on the other side. If you let go of shame, what other feelings would you be having? Journaling about that, and then going into your therapy session the next day, whenever you're going to therapy, and actually really have a conversation with your therapist so that you can begin to develop different strategies to really not just say, I want to let go of the shame, but what are we going to do to help you to actually do that? So that's sort of the piece where I come in. I'm not doing therapy with the clients at Mindbloom, but I'm offering different examples and talking more in depth about the different aspects of trauma, so that if they watch that content, they can then bring that with them into, and again, it could be their therapist or whoever their main supporters are in the process of trauma recovery.
So, and I'll put this out there as a question to both of you. In talking about ketamine therapy, if we had this big whiteboard in front of us and we wrote down psychotherapy, and that might include somatic therapy and talk therapy and all the different types of therapy, and then you had ketamine therapy, I'm wondering, because ketamine therapy almost feels to me it's not talk therapy, right? So where does the circles, where do they overlap in a sense?
Mm-hmm.
Yeah, so I'd say like the way that I understand ketamine work, and I've seen personally through my experience with my clients, is that ketamine can be a very, very supportive in tandem with another psychotherapeutic process that's going on. And the way that I see that happens and why is twofold. So one, if we think about what ketamine does neurobiologically, ketamine enhances neuroplasticity. And what that means is it essentially repairs damage in our brain that's happened maybe over time from our stress response, like cortisol, it's damaging on the tissue in our brain, especially the parts we need for forming new memories or higher level cognitive thought processing, emotional regulation. So ketamine's restorative in our brain. So it kind of makes, from a biological standpoint, creates an ideal space for therapy, processing new thoughts and emotions and ways of viewing ourselves and the world around us. And then ketamine as a treatment during an experience, I think about it as kind of like puts us in a third person point of view, where we can kind of step out of ourselves, look at ourselves, and get a different context or awareness of our, like, maybe narratives that we've had or viewpoints of ourselves. So we're like able to kind of just get out of our stuckness in a way, access new content information that can then be valuable for us in treatment. The other piece of it is that this neuroplasticity and this openness doesn't necessarily like go away right there after your treatment. Like we do see like people have periods of days after treatments where they're like maybe like a little bit more open, less resistive, like less feeling more calm and in peace, which then creates like more openness or space to then go further in therapy. I've worked with clients who've been really stuck in their process with EMDR, is like one that comes up for me front of my mind. And it just has been a game changer with them being able to move forward in steps in that process by feeling more safe and like less like defenses up and tight. So I've just really see it help people get unstuck, which then is very supportive in the other modalities for treatment that they might be going through.
Shoot that. And Shari, you're shaking your head.
Shaking my head saying, don't forget what you need to say, because this is so important. But there's a few words that I would write on that whiteboard: integration, reframe, and finding words. When I think about all the work that I've done with survivors through the years and their struggle to even be able to talk about or describe what happened to them, and then integrate these horrific memories and figure out how, when our memories are getting triggered, how do we bring ourselves back to the present? Because that's what integration is. And reframe is sort of like what I was saying before, letting go of shame. Once I can reframe my experience and look back on that flashback or memory and go, wait a minute, that wasn't my fault. I was just a kid then, and that person was an adult. To be able to reframe what happened to us, that is partly what helps us move into a place of peace and contentment and keeping our feet on the ground and being right here in the moment. So those are the things that I think about when I think about the advantages of adding ketamine to treatment for PTSD. And that's one of the reasons why I wanted to be involved in this program, because I see so many people struggling for years. Right. You get to a certain point in the work where you've talked about it, you've remembered it, you have flashbacks, but there's a whole nother level of processing in terms of our feelings and the impact of our trauma that I feel like Mindbloom and ketamine is really going to help people to be able to push past some of those issues.
So as we kind of wind down here, I think I would be remiss if I didn't bring up the topic of worries that people might have around this, right? I mean, this is, for all intents and purposes, new in the therapeutic space. Obviously it's not, but it's getting more and more traction and so forth. How would you allay people's concerns about this, Kristin? Maybe people are really interested, but I mean, there's so many things that could go wrong. I don't know. What would you say?
Yeah, I'd say, like, generally, from my experiences, and I think the data that's out there published around side effect rates for ketamine therapy versus SSRIs, people seem to tolerate the ketamine treatment very well. I'd say, like, we have side effect rates are about 5% or so in the study that we've published. People experience side effects. We compare that to about, much higher than that for SSRIs. I think the big difference too is, like, thinking about safety, and why I like ketamine as an option for people is since you're not taking it every day, it's not like your body is growing a tolerance or becoming used to this medication, or leading to the point of where you could develop a long-term side effect or issue from the medication. It's in and out of your system pretty quick. Like the half-life is 2.5 hours or so. So you take the medicine, and within 2.5 hours, it's about 50% out of your bloodstream. So if we're thinking about the burden on your body physiologically compared to an SSRI or something that you're taking every day, you just can't compare. The other thing I would say too is that our clients going through our program, like, work very closely with the clinician to find the right dose for you. So like I said, we're not aiming for, I think people might get scared of, like, having a bad trip or, feeling out of their mind or not in control of things, which can be scary. Like, that's not what we're aiming for with dosing. We want our doses are, I wouldn't say mild, but the goal isn't for it to be mild, but for you to still be conscious and aware, so you can remember the experience and have things to journal about and feel safe. So I think that's another big component of it, is that, like, you have a lot of guidance and support to make sure that you're started at the right dose, and your dose is adjusted appropriately to create safety, especially with you being at home doing the treatments.
Awesome. All right. Again, speaking with Dr. Kristin Arden and Shari Botwin, Mindbloom. Kristin, what's the best way for people to learn more about this and get in touch with you?
Yes. So the best place is through our website. We have a ton of great information around on our website, both in, like, safety, our safety page, and our science page. We have lots of blog posts, and people can reach me if they have questions for me specifically, just by emailing support@mindbloom.com and asking for me, and they'll direct the message to me.
Okay. And Shari, how about you?
I would say the best way to find me, if you want to ask me more questions about my role in all this, is to just go to my website, which is just my name, sharibotwin.com, and my email address is in there. And I welcome people to reach out if they have any questions.
Awesome. Appreciate it. Obviously, this topic is huge, and we're going to do another couple episodes on this, but I really appreciate you both coming on here. It's fascinating. Thank you.